Greetings to you all. My name is Dr. Omeri Ombonye, the Managing Director, Hopkins Hospitals, and welcome to a discussion on low back pain, a condition which is on the rise because of the lifestyle and activities that are carried day by day by all of us. So this is a condition which affects the low back, as I shall explain on the anatomy of the low back of the human being. We have the vertebra, which is the bony component that protects the spinal cord, that runs all the way from the cervical vertebra to the coccygeal vertebra. So the cervical vertebra runs from C1 to C7 on the upper part of the back, which consists majorly on the neck. And then we have the thoracic, which runs from T1 to T12. And then we have the lumbar curve, which runs from L1 to L5. And this is where basically we have trouble when an individual has a low back pain. And then of course the sacral, where people sit on, as well as the coccyx. The sacral from S1 to 5 and the coccyx C1 to 3. So this is basically the anatomy of the back. And of course we have other soft tissues like the muscles, ligaments, tendons, and then of course the spinal cord and the nerve roots, the chorda equina, the very low aspect of the after the lumbar vertebra. We have the chorda equina, from which the nerve roots emanate. So any problem with any of these structures can cause a low back pain. We can also have what we call as referred pain, which is pain from pelvic structures. For females, we have the uterus as the female part of the female reproductive system. So pain or anything which causes pressure symptoms from the pelvic area will also cause low back pain because of that kind of what we call as referred pain. For the men, we have the prostate and of course the testes, the torsions, and any other thing which can cause pain on the pelvic area can also be referred to the back. But these kind of pains will definitely be originating from these particular organs. And generally we also have the kidneys on the flanks or the iliac region extending to the lumbar region. So pain which is as a result of what we call as renal colics or ureteric stones or any other cause of pain within the kidneys and other structures around will also cause referred pain. Who is at risk of low back pain? As we've said, anybody can be at risk of low back pain, but now there are those conditions which will of course put people at high risk of low back pain. The first one is advancing age. Above 40 years, this is the commonest age group of people with low back pain because of bony conditions, as we shall discuss. And then generally, we have sports activities which are extreme. For example, rugby, athletic activities. We have football. In case of trauma or straining or spasms or hypertonic spasms of the ligaments, of the muscles, that will definitely be a source of low back pain. Very tall people will also be in a high risk for low back pain. Remember, the back is designed in a way that it supports the body by supporting the weight of the body. When we talk about the center of gravity, we have the support of the body coming at the low back. And apart from the support, we also have protection of vital structures that we've already mentioned about. We also have flexibility of the back because it's a joint, definitely the vertebrae we've discussed, and the hip consists of various joints, so movement also happens at the lower back. So all those factors which can cause a problem with any of this will contribute to low back pain as well. So obese people or overweight people, very tall people will have support of the entire body coming to the low back because of that overweight. And then another group of people at risk are those who are heavyweight lifters, people who work in the gym. We also have long distance drivers, truck drivers, or passenger drivers. You know, those people sit for a long time, so sitting or a prolonged body posture will expose somebody to a low back pain. So that also brings into picture of people who work in offices, doctors, people work with computers for a long time. We also have janitors who are involved with heavy manual duties, cleaning. People work in warehouses and they carry heavy lifts. So those are the kind of people, and not forgetting the nurses or health workers who are involved in helping patients. Some of the patients can be heavy, and depending on how they lift, so that can also be a risk of low back pain. The symptoms of low back pain is just pain, which is depending on the severity, will be moderate to severe. And if it's severe, depending on the cause, we can also have other symptoms like numbness and paresthesia of the extremities. When we have what we call as disc prolapse or herniation, compressing one of the nerve roots, then that may affect some of the vital functions of the lower back and the structures which are supplied below. We have what we call as the sciatic nerve, which is the main nerve that passes from the low back after supply from the cauda equina. Then it passes through the bony structures, passes through the anterior aspect through the anterior medial aspect of the thigh down to the leg, and that supplies all the the nervous system of the lower limbs. So if there is anything which causes prolapse of the intervertebral discs, the intervertebral discs are cushions within the vertebral body, which are normally like shock absorbers. So undue pressure to these discs because of heavyweight lifting, because of some of the chronic inflammatory conditions of the back like osteoarthritis, because of bone encroachment conditions, for example spondylolisthesis, stenosis of the spinal cord, or other congenital conditions, will expose the nerve roots to pain or will cause nerve irritation. So we have what we call a sciatica. Sciatica or the lumbago disc disease are basically the same things which happen as a result of nerve irritation. So if this is severe, because this will also determine the kind of treatment that we are going to give to this patient. So we can have effect to the bladder. So people, because the bladder must also be controlled by nerves, so that when you have the urge to go and urinate or empty the bladder, then you are able to have that sensation. But when we have injury to some of these critical nerves from the nerve roots, we have what we call as urine incontinence, stool incontinence, and inability to have sensation of the lower limbs, numbness of the lower limbs, and paresthesia, what we call as tinkling sensations of the lower limbs. So those are some of the symptoms depending on the severity of low back pain. But most of the time, the commonest causes of low back pain is what we call as spasms, or hypertonic spasms, or straining of the muscles. That is for the general population. The few causes of low back pain that can be extreme could be traumatic causes, which could be as a result of road traffic accidents, fall from heights, or falling objects from above if they cause injuries to this particular part of the body, or extreme of sports activities which can cause traumatic injuries, as we've said. And then we also have those people who play golf because of excessive twisting of the low back that can also cause spasms of the back.